Hello and welcome. In this explainer, we're going to tackle a really heavy but important topic. What actually happens, step by step, when the spinal cord is completely severed? Let's dive in. So think of your spinal cord as the body's master communication cable. It's this superhighway of information running between your brain and, well, everywhere else. The big question we're looking at today is, what happens when that cable is just cut? What signals get totally lost, and what strange new messages start popping up in their place? So here's our plan. We're going to start by pinpointing the exact injury we're talking about. Then we'll get into the immediate shockwave that rattles the body, and after that, how the body literally rewrites its own rules a few months down the line. We'll also cover the ripple effects across the whole body and finish up with some really critical medical alerts. Okay, first things first, we have to get specific. Not all spinal cord injuries are the same. Where the injury happens, well, that changes everything. The specific case we're breaking down is a complete transection. That means a full cut, right at the T4 level of the spine. The easiest way to picture this is to imagine a line drawn right across your chest, at about nipple level. Everything below that line is now cut off from the brain. It is a total, complete communication blackout. So what happens in those first few moments, the first hours after the injury? The body's reaction is instant and, honestly, it's extreme. It's basically a state of total shutdown below that line of injury. In the medical world, this is called spinal shock. And you know what? The analogy on this slide is just perfect. Thinking of it as a citywide power outage is the best way to get it. All the lights go out. All the systems just go silent. Below that T4 line, the nervous system just stops working. And this really shows you what that power outage looks like. Sensation below the chest, it's gone. Movement? The muscles go completely limp. It's a condition called flaccid paralysis. Even your basic reflexes just vanish. And this is a big one. Your autonomic nervous system, the thing that runs all your background processes, is thrown into total chaos. Without the fight or flight signals getting through, the rest and digest system is left in charge, all by itself, which causes blood pressure to just plummet. And right away, control over bowel, bladder, and even body temperature is gone.
But here's the thing. The body doesn't stay in that state of shock. After about 3 months, it starts to adapt, and a totally new and very different set of rules starts to take over.
This slide is so fascinating because it shows just how strange the body's adaptation process can be. So, sensation. The numbness is still there, but now new and often really severe nerve pain can show up. In terms of movement, that limp, reflexless paralysis does a complete 180 and turns into spasticity, where the muscles get super tight and the reflexes become wildly overactive. And that low blood pressure from the beginning, that gets replaced by the risk of sudden, incredibly dangerous spikes in blood pressure. The body's trying to find a new normal, but the new systems it creates are really unpredictable.
So that brings us to a really important question. With all these new rules the body is playing by, what is the single most dangerous long-term risk we need to be aware of?
And the answer is something called autonomic dysreflexia. This slide lays out the scary chain reaction perfectly. It all starts with something that should be harmless below the injury, like a full bladder or even just a wrinkled sock. The brain can't feel it, but the nerves down there send a signal. The disconnected spinal cord then totally overreacts, sending out this massive alarm. This causes all the blood vessels below the injury to clamp down hard and blood pressure skyrockets. The brain feels this and sends an urgent, everyone calm down message. But that message hits the roadblock at T4. It can't get through. The result is a full-blown medical emergency that could cause a stroke or even be fatal. Now, a spinal cord injury isn't just about the nerves. The consequences create a ripple effect that touches almost every single major system in the entire body. Let's start with breathing. Okay, so with a T4 injury, the diaphragm, your main breathing muscle, still works, but the muscles in your abdomen and lower chest are paralyzed. So what does that mean? It means your cough gets really weak, which makes it tough to clear your lungs of gunk. Your chest can't expand as fully, so your lung capacity drops, and breathing itself just becomes less efficient. The diaphragm is left to do all the work on its own, and it's just not as effective that way.
The digestive system takes a big hit too. Everything slows way down, which leads to a huge risk of constipation and blockages. And remember how that rest and digest system was running wild? Well, part of that system is the vagus nerve, and it's constantly telling the stomach to make more acid. Without the other signals to balance it out, that can lead to stress ulcers. Even the gallbladder gets involved, with changes in bile creating a higher risk for gallstones.
All right, now for something really critical, blood clots.
In medicine, there's this idea called Virchow's triad. It's basically the three things you need to create the perfect storm for a dangerous clot. And after a T4 spinal cord injury, boom, all three factors are suddenly there, creating a massive risk for something life-threatening, like a clot traveling to the lungs.
So what makes up this dangerous triad? First, blood flow slows down a lot. Being immobile lets blood just sit and pool in the veins. And since the calf muscles aren't working, you lose that pumping action that helps push blood back to the heart. Second, the trauma itself makes the blood stickier and more prone to clotting. And third, the blood vessel walls can get damaged. You put those three things together, and you have a recipe for disaster.
Okay, so given everything we've talked about, all these huge changes across the whole body, it's pretty obvious that medical care, especially something like surgery, has to be handled very, very differently. There are some huge red flags to be aware of.
And a perfect example of this is choosing the right kind of anesthesia. This slide makes the difference so clear. A regional anesthesia, like a spinal block, is almost always the better choice. Why? Well, for one, it dramatically reduces the risk of that terrifying autonomic dysreflexia we just talked about. It also helps protect the lungs, which we know are already fragile. General anesthesia, on the other hand, is loaded with risks. Airway problems, making breathing worse, and a really high risk of aspiration, because we know the stomach is emptying much more slowly.
Okay, here's a very specific and incredibly important question. There's a common muscle relaxant called succinylcholine that doctors use all the time. But for someone with a recent spinal cord injury, it can be lethal. Why? What's going on?
The answer is this fascinating biological process called receptor upregulation. Think of it this way. The paralyzed muscle cells are just desperate for a signal from the nerves. They're starved for instructions. So what do? They start growing tons of extra receptors all over their surface. It's like they're putting out hundreds of extra antennas, just trying to catch the faintest signal. Now, succinylcholine works by activating these receptors. So when you give it to someone with all these extra antennas, it's like a lightning strike. They all fire at once, causing a massive flood of potassium to pour out of the cells and into the blood, which can literally stop the heart.
Now, this isn't a permanent risk, and that's key. There's a very specific danger window. The risk really starts about 72 hours after the injury as those extra receptors start popping up. That period of extreme danger lasts for about 6 months. After that point, the body has stabilized and the risk goes down. Knowing this timeline is absolutely essential for keeping patients safe.
So we've gone from that initial citywide power outage to the body's new, sometimes chaotic rulebook and the critical medical alerts that go with it. What's so clear is that the body, even when facing something this catastrophic, is a master of adaptation. It fights to create a new normal. And that brings us to our final thought. If we understand all these complex changes, the good, the bad, and the dangerous, how can we use that knowledge to better support the body's incredible, resilient process of adaptation? Thanks for joining.